These videos we hoped would let our staff talk about what reconciliation meant to them. I think it's crucial that as part of our reconciliation action plan that we make it real for Menzies. How do we work with each other? How do we work with communities? What are the principles that guide the way we work with a primary focus on Aboriginal health research? So if we're talking about recognition and reconciliation, getting people to tell their stories about how it affects them as an individual and thinking about what we should do as Menzies as an institution is really important.
I think it's a great time for people to share ideas and brainstorm on ways to improve the health for Aboriginal and Torres Strait Islanders in Australia, and particularly the Northern Territory.
Reconciliation to me means working together better and recognising people's contributions.
Reconciliation to me represents an acknowledgement and understanding of injustices that have come in the past and charting a way forward. How can we as researchers and as Menzies do things properly into the future, do the best Aboriginal health research and provide the right environment to grow our Indigenous staff.
Reconciliation is about bringing together Indigenous people and working with non-Indigenous people to close the gap of disparity. Out of respect, we all need to recognise the history of Indigenous people and value the culture and beliefs of Indigenous people. Out of relationships, we need to make a change and make a difference so we can build trusting relationships, lasting relationships with Indigenous people and their communities. We need to work together so that we can learn two ways, the Western knowledge and the Indigenous knowledge.
We need to recognise what's happened in the past so it can inform what happens in the future.
Yeah. I think Menzies is definitely one of the Australian institutions that are solely dedicated to improving Indigenous health and sort of reconciling this divide between Australians.
I think I need to, as a researcher, think about how I work in teams with other researchers. What are the roles of Indigenous researchers within our teams? Recognising people's understanding and experience and really making people feel fully valued members of a team. I've got a number of Indigenous PhD students, and I think ensuring that I give them the right support to undertake their research, to grow and become independent researchers. That takes effort of someone who's supervising someone, and I think working out how I can best support them to grow as independent researchers is something I need to do personally.
As an Indigenous employee, I'm really happy about the level of support I have received in Menzies, and it's really important that we get it right so that we can do our best to increase and encourage other Indigenous people to work with Menzies and encouraging them to become researchers as well, to work better in our communities and also to assist our non-Indigenous researchers with getting the message through about health and chronic diseases.
Yeah, it's great to see Menzies being a leader in not only Indigenous health research but also in the reconciliation plan.
At the moment it does seem like things are getting better, but I'd like to see particularly improvements in the rural areas where we see a massive difference between, for instance, prices of food, which is just, it's not accessible to get healthy, nutritious food out in rural areas.
If we're talking about recognition, I'd like to see Menzies being recognised as a place that does the best Indigenous health research, that we address the problems that are real priorities for communities, that we do things in true partnership with Aboriginal communities and health services, and that we really value the work of our Indigenous health researchers. I want Menzies to be seen as the place for Aboriginal and Torres Strait Islander people to come, do research, grow as researchers, and that they'll stay and work with us and become leaders of Menzies in the future.